Next, we're going to look at the right coronary artery. This artery arises from the right coronary aortic sinus and travels through the coronary sulcus, continuing around to the inferior surface of the heart. During its course, it gives off several branches, including the sinoatrial nodal artery, conal branch, arterial branches, ventricular branches, right marginal artery, and inferior interventricular artery. Phew, that sounds like a lot. Fortunately, their names give us insight into their location and supply to make it a bit easier to learn. So let's go and take a closer look at each of these branches. The conal branch is first to arise from the right coronary artery. It runs between the base of the conus arteriosus and the superior part of the right ventricle. This branch, as the name suggests, supplies the region of the conus arteriosus of the right ventricle. Within millimeters after emerging from the aorta, the right coronary artery also gives off the sinoatrial nodal branch, which extends to and supplies, yep, you guessed it, the sinoatrial node. However, it should be noted that in about 40% of the population, it has been known to arise from the circumflex branch of the left coronary artery instead. Also arising from the right coronary artery are a series of atrial branches, which are commonly grouped into anterior, lateral, and inferior branches. These branches supply the right atrium of the heart. The next prominent branch of the right coronary artery is the right marginal branch, which runs close to the inferior border of the heart along the right ventricle. This branch, in addition to several smaller anterior ventricular branches, supply the right ventricle of the heart. Finally, the inferior interventricular branch, also commonly known as the posterior descending artery, or PDA, runs along the inferior interventricular sulcus and is the terminal branch of the right coronary artery. It supplies blood to the inferior part of the interventricular septum and adjacent surfaces of both ventricles. Now, it should be noted that the inferior interventricular artery arises from the right coronary artery only in individuals considered to be right heart dominant. If you found this quick anatomy or physiology video helpful, you'll enjoy our video tutorials even more. Click on the button and you'll see what I mean. We have hundreds of videos available to our premium members, not to mention all the fun quizzes, complete articles, and atlas sections to solidify your knowledge. Click on the button in the middle to watch the full-length video and master anatomy and physiology.